The next taping we are going to do today is for patients who come in complaining of shin splints, pain that originates usually around the tibia, or also known as the shin bone. We are going to do two different types of taping. The first taping we're going to do is going to be an inhibition of the muscle called the tibialis anterior, and it runs from here around the foot and up toward the knee. Essentially, the bulk muscle is right in this area. So we're going to do an inhibition, and I've already cut my taping for that. And then we're going to follow up with the next taping. We're going to do some fascial corrections in this area where the fascia is coming away from the bone, and I will show you both of these tapings today. First thing we're going to do is we are going to put her on a stretch, which is into this position. I'm going to get my anchor ready. I'm going to come around where that tibialis originates. And this tension is paper off tension. We are inhibiting a muscle. Bring the tape around that muscle. We are using a Y strip today that I have previously cut. I will take my Y strip and we're going to outline that tibialis anterior. Again, no tension. I'm just laying the tape down. Once we have that tape down, she can relax her foot. I'm going to rub to get the glue to adhere. So we have followed the tibialis anterior muscle, up the leg. Okay, the second taping we're going to do is we're going to do a fascial correction. I have pre-cut my tape, and essentially what my goal here is to try and keep the fascia from coming away from the bone, which gives the patient that medial stress or that pain that they're experiencing with the shin splints. You can do one, you can do two, you can do three. It's according to how far along that shin bone or that tibia the patient is complaining of. I have cut two. She is complaining of pain in this area. So we are going to use about 50% tension. I've got my anchor. Again, no tension on the anchors. Okay. From here, I'm going to do a little bit of a fascial correction. So essentially, I'm going to take my tape, put about 50% tension, and I'm going to pull and kind of oscillate to keep that fascia toward the tibia or the shin bone. No tension on my anchors. I go to my second strip. I'm holding for stabilization. I'm oscillating the fascia toward the tibia or the shin bone. No tension on my anchors. Okay, she's complaining a little bit higher, so we're going to do a second taping. Same concept. Anchor, no tension. I'm going to hold and stabilize the anchor. I'm going to give about 50% tension, and again, oscillate toward the bone. No tension on the anchors. Stabilize, 50% tension. I'm oscillating. No tension. Try to make sure the tape does not land on each other. The tape will last longer. After I've got everything in position, I'm going to do my rubbing to get the glue to adhere. I'm going to give the patient instructions on wear time, and also see her back in a couple of days and see how she is feeling as well as how she performed in her game.